We're going to get started in a few minutes. Looks like everybody's rolling in and we're heading over the 300 mark. So welcome. We'll let everybody join us and then we'll get started here shortly. So while we're waiting, if you want to go into the chat box and let us know which MRC unit you're from, that would be great to see. In the chat box this afternoon, Laura Cash, who is our program coordinator, is there and we'll be posting links, answering any questions, and actually taking questions so that when we have a little extra time at the end, she can ask me whatever questions I don't cover while we're doing the presentation. And I'm going to mute my phone because we are sending out alerts to volunteers to deploy in the field. And it looks like it's going to be a busy afternoon. So I'm going to mute my phone. If you do have your phone, personal phone, have it handy. Not that you look at your social media feeds during the presentation, but I do have some work that you need to do on your cell phone a little later on in the orientation today. Let us bop over 400, make that the mark, and we'll get started here. We're down 4. The largest orientation we've hosted, I think, was about 900 people. So I think 400 for the middle of the week over lunch is a good attendance. All right, we'll take it. So good afternoon. My name is Jennifer Freeland. I am the state volunteer coordinator here at the Virginia Department of Health, and I coordinate and manage our Medical Reserve Corps program. Thank you for joining us today. We're going to get you onboarded into our program so that you can support the local health department's response to COVID-19 pandemic. So the different things that we'll cover today is we're going to go over the mission of the MRC, look at our focus in public health and our response to COVID-19 and other emergencies. We really want you to understand your role as a volunteer, the responsibilities you have, our protocols for serving your community. And we will take a tour of the Virginia Volunteer Health System and Train Virginia, which is our learning management system. And we'll talk about the next steps to becoming a deployable volunteer. From really bad things come good. And our program is a direct result of September 11th. There were so many healthcare providers that wanted to support their community in either medical capacity or to assist in dispensing anthrax medication that the federal government created our Medical Reserve Corps program. Additionally, we have the emergency system for the advanced registration of volunteer health professionals. That is the Virginia Volunteer Health System. And married together, those programs support the Virginia Department of Health and are doing amazing things in the communities to help us with this response. In non-emergencies, volunteers do great work. I'm not going to go over all the things we do, respond to the opioid epidemic, do outreach to our homeless population, really anything that a local health district could use additional staff to support and provide services to the citizens, they can reach out to MRC volunteers. And our tagline is Volunteers Protecting Virginia's Health. In emergencies, we are Emergency Support Function 8, and we're responsible for core of 4 things. One, we coordinate medical, public health, mental health, and emergency medical services. So VDH is the coordination lead, but we don't provide all of those things. Medical is our healthcare systems, our private providers, our pharmacies. Mental health services is our local community services board. Our EMS agencies are sometimes affiliated with localities or nonprofit organizations. VDH, of course, core to what we've been doing ever since this pandemic started is active disease surveillance and investigations, and that has included contact tracing, and monitoring of the disease spread throughout the Commonwealth. We have a responsibility in the Public Health Emergency Preparedness Program to establish plans and procedures for being able to dispense medication or put shots in arms as quickly as possible. Many years, well over 16 plus years of planning and efforts is what we're seeing actually put into practice today. And we have done a great work in Virginia, and as vaccines are available, we're going to continue to do our mass dispensing. And although it isn't related to COVID-19, I wanted to make sure you're aware that we also, Medical Reserve Corps volunteers, support mass care shelter operations. So for some reason, if we got a big winter storm and we needed to set up shelters, you may be requested to deploy to that if you are interested and available too. We support the medical functions, so providing first aid and assisting community members that might have functional or medical needs. And that is a possibility. I don't think I'm getting snow today, but I believe many of you throughout the Commonwealth are white in snow coverage. If we had the need to deploy volunteers for that, you could get a call. So our COVID-19 response efforts started in February, and I am not a subject matter expert in COVID-19, epidemiologist, track the testing or vaccinations. The best source of information for you is our COVID website. From there, you can get to the information about vaccine, finding testing opportunities, looking at the data. So I really encourage you to visit that page frequently because data does change every day. And it's good for us to stay aware of what's going on in our community and know the most recent guidance that's being provided from the Center for Disease Control in our response to COVID-19. And the MRC has played a big role, larger than I think any of us ever anticipated. And we have volunteers that are very excited, I hope like yourselves, to being a part of our VDH team. And this is actually pictures of volunteers that were distributing T-shirts and badges and goodie bags to volunteers in a drive-through event. So we use our mass vaccination drive-through model to actually give things to our volunteers. And I just like this picture because it really does show the enthusiasm of all of our MRC unit coordinators and volunteers and really mobilizing the MRC to be able to do just wonderful work in the communities. And we started very early on with contact tracing. Volunteers in the northern regions started to monitor travelers who returned from other countries where there was disease prevalence of COVID-19. And we started to track their symptoms and whether or not they get sick and contact tracing. And so it really began very early on in February that volunteers were engaged in our contact tracing and investigations. And thereafter, it just blossomed. We had statewide teams that supported outbreaks in the Eastern Shore. They were virtual. Volunteers working in the health department, still even working in the health department today, doing virtual work throughout the Commonwealth, whatever is needed for the local health departments. We have healthcare providers that were even on the phone answering questions from other healthcare providers. We might have to ramp up and do that again, as many healthcare providers do have questions about the vaccine. We are in the process of a statewide call center. However, many of our local health departments have set up individual call centers. And volunteers have been staffing call centers since March of last year. This is in Alexandria. We have an Eastern Region team that every day staffs the call center in the Eastern Region, Peninsula, throughout the state. Volunteers are messengers of the COVID-19 information and help to reassure community members that they can get the information and care that they need, and really to try to reduce fear, make sure that people are, confident that they're being taken care of, and help all of us to get back to a new normal of living. In addition to public information, we help to distribute information through care packages. And this is in Norfolk, where we develop care packages that after a testing event are provided to community members that come through that event. So it's included mask, information about COVID-19, other services. And so those are provided at testing events, but they're also provided, and we haven't done one of these lately, a community walking event where volunteers have gone door to door in communities, knocked on doors, handed out that information, told community members about testing events to try to get them to come. I expect we might see a similar model as more vaccine is available. We'll try to do outreach into some of our targeted populations and community members to make sure that they are aware of their accessibility to receiving the COVID vaccine. So we are boots and feet and the messengers of the Virginia Department of Health regarding COVID information. Volunteers also staff our local health departments in doing public health screening. So at the door, making sure that those that are coming in for client services are properly screened and wearing the appropriate PPE or face covering mask as they come in and interact with our staff members. Early on, we not as much now, but we did a huge outreach in providing fit testing of N95 masks. So if anybody is deployed to support testing events and performing the swabs that are needed for testing, our volunteers receive an appropriate, well-fitting, well-tested N95 mask. We have also provided N95 mask fit testing for our first responders, our long-term care facilities, other partners in the community that need those masks. We've done some outreach and supported them as well. And the healthier we can keep our healthcare providers, the more they can provide patient care. And that is really critical because we have a workforce shortage in healthcare and even in public health. In community testing, we tested a lot of different locations. This was a tent at the back of the parking lot of Obice Hospital, and MRC volunteers staffed the entire tent. In Blacksburg, we had drive-through testing models, and this was the, I think this is in the Virginia Tech parking lot. These are some students. So in many different ways, we have offered testing to the community, and we'll use some of the models that we had early on for point of testing, or actually they were models that we've been practicing for years for point of distribution of pills. We just modified them. Instead of handing out pills, we've swabbed people's noses. So you'll see maybe as weather improves that we might be moving some of our mass vaccination for COVID back to the drive-through model if they get creative about how to do that. But it is a process that we're very well practiced in. Unexpectedly, because of that workforce shortage that I just mentioned, we did deploy Medical Reserve Corps volunteers to long-term care facilities very early on when there was a significant workforce shortage, and a lot of the healthcare providers that took care of patients were no longer available. And we had some amazing nurses and support volunteers that went to long-term care facilities. I just want to include this. I don't think it's not a part of our mission anymore, but I think it's really notable that we had volunteers that were willing to do this. And very heroic that they did. And they went into facilities that were had large COVID outbreaks and did great work. If you're not capable of being in the field at the moment, some of our local MRC units have virtual volunteer opportunities. And we have virtual case investigation, contact tracing teams. Just know that even though we're so focused on COVID, we still have to do daily public health. So we may not be doing contact tracing or case investigation for COVID. It could be for norovirus or pertussis or any of the other diseases that typically raise their head in the winter. We still have to do our regular work at VDH. And we have volunteers that right now are supporting our ongoing everyday public health response, our public health initiatives and tasking. We have some MRC volunteers support their local health districts with managing Facebook. And if that is your passion and gift, you can definitely let your MRC unit coordinator know and see if they need any assistance there. But by far, our largest and most important mission ever is mass vaccination. And this is not the first time that the MRC volunteers have been mobilized during a pandemic for mass vaccinations. During H1N1, nearly 2,000 Medical Reserve Corps volunteers supported 743 vaccination events. We're probably already getting close to topping that. Actually, last week we had 2,300 volunteers staffing some of our community and closed mass vaccination point of dispensing locations. So this is, we need volunteers to help us put shots in arms in many different ways. Right now, you're aware that we're only at 1B. And we would like to be moving through much faster and being able to provide vaccinations, but we're limited by the vaccine supply, and the vaccine is allocated based upon demographics or the amount of citizens within each of the communities. So our larger cities, actually Virginia Beach has the largest population. They have a larger vaccination event because they're receiving more vaccine. And some of our smaller health department, more rural areas are not having that type of vaccination event because they don't have the vaccine to do it. So just know where we are. We will quickly ramp up when we get to 2 and 3 phase, and more volunteers will be mobilized. I think the challenge right now is we don't have enough vaccine. We have plenty of volunteers at the moment, but we don't have enough vaccine. And our volunteers that are supporting the mass vaccination events are vaccinated if there is vaccine available at the end of their shifts and at the point of dispensing or community vaccination event. This is a volunteer out in Roanoke that was receiving his vaccine after there was a tent that we'd set up for our first responders, and we had vaccinated all the first responders and we had doses available. So our MRC volunteers that were supporting that event received doses. We do not have enough vaccine to just set up a vaccination event for all MRC volunteers. Some volunteers that are having that direct interaction with the public are considered 1A. We cannot provide any fast passes for volunteers that are not supporting the community directly in a public-facing a mission, role, and responsibility. We encourage you as those phases go through that you take the opportunity to get vaccinated as the 1A, 1B opens up. And when you feel like you're protected and vaccinated, that you come in and help to support the mission. We do many things, and before we even set up a pod, we have to plan for logistics of the people and the stuff that make a point of dispensing or mass vaccination event. I'm going to use those two terms back and forth. POD is a acronym that we use in emergency public health emergency management for a point of dispensing. So we can be dispensing a lot of things, but I'll say POD, and you may hear that as a community vaccination event out in the public. One is the same. Some of the pods are open, some of them are closed, some of them are very large, and some of them are very small. Okay, just want to get that out of the way. So it takes logistics, it takes people, it takes packing to be able to set up any vaccination event. And volunteers have been going to the health departments and assisting us with that. So, you know, if you work and you do logistics and you're not a medical volunteer, this will be a great fit for you. And we'd love to help you, have you support that mission. Volunteers at a vaccination event often are greeters and do flow control. Make sure people are maintaining their 6 feet social distance or appropriately wearing their masks. And that is a mission, and I didn't even mention it earlier. The infection prevention mission is one that was very large for us for the elections. And we had nearly 800 volunteers on election day working in their poll locations to make sure that people followed the precautions to prevent spread of COVID, and they did a fantastic job. But similarly, we're doing that same role in our point of our pod locations. Volunteers also do data entry. We have to use different systems to track individuals that come in and get the vaccine. So here are 2 volunteers. This is at Avery University in their gymnasium, the large community event. I think that they did about 1,300 vaccines on a Saturday. And so volunteers serve in that way as well. We have a large core of nearly 7,000 medical volunteers. Of those, 1,500 of them have completed the training and skills check process to be able to vaccinate and administer the COVID-19 vaccine. Here pictured is actually one of our MRC unit coordinators, Francis and Loudon, and 2 MRC volunteers that are providing vaccinations to the first responders and officials, leadership officials to in their community in Loudoun County. We do have pharmacists that are working, particularly if we are administering the Pfizer vaccine. We have kind of little mini pharmacies within our pods, and those volunteers are making sure that the vaccine is dosed properly, that it is mixed properly, because it's really cold if it's Pfizer. You can't take the vaccine, it's super cold, and put it in somebody's arm. It has to be diluted. So we have pharmacists that are doing that, and it's a great robust way that we can more quickly put vaccine in people's arms. So we're continuing to develop that as part of our model as Pfizer vaccine is available to us. Primarily, Pfizer initially was distributed to the hospitals, and some hospitals had leftover, and some of the health departments are helping to administer that, and we've been able to bring that in and help to meet our 1B community members. And if you're not a licensed healthcare professional currently, you don't feel comfortable providing the COVID vaccinations, we have monitoring areas after each of the vaccines are administered. Some people have to wait 15 minutes, some have to wait 30 minutes, and we have a team of kind of healthcare professionals that monitor the people that are vaccinated to make sure they don't have any reactions to the vaccine. Wow, that's a lot. And those are just kind of little pieces of just a preview of some of the positions. I didn't go through all of the positions in a vaccination location, but the reason why we're here is because we need volunteers. Some of our local health departments only have 1 nurse, and they might only have a staff of 4 or 5 in the very rural areas. There are not enough public health nurses to vaccinate with a COVID-19 vaccine. And, you know, we're very thankful for the vaccine, but it has doubled our workload because, of course, most of the vaccine that we're receiving requires 2 doses. So that even more puts a strain on us, and there is that limited workforce capacity. We could not do what we have to do for our COVID-19 vaccination response, and we certainly could not have done all of the great work that we've done for, you know, contact tracing and call centers and all of that without Medical Reserve Corps volunteers. we don't have that capacity. And everyone has a place to, provide an opportunity to share their skills and really plug into this great public health team. And I think the number one qualification that it takes for somebody to be a Medical Reserve Corps volunteer is that you're passionate about public health. You're passionate about being part of our MRC public health team, and you're willing to serve your community and do great work. And we are taking all healthcare professionals, anybody that's on the list. We do typically get questions of, can dentists vaccinate, can veterinarians, dental hygienists. There currently is some consideration for extending, allowing individuals that currently are not licensed to vaccinate, for them to be allowed to vaccinate. That hasn't been formally announced yet. However, I think that we will see that shortly, and that'll open the door. Additionally, some of our retirees will be allowed to come and assist with vaccinations as well. It might require a little extra training because you haven't been out in the field, but again, I expect that those doors are going to open up so that we have an even larger vaccination workforce, and we're excited to make that happen. And we look forward to being able to integrate you into our vaccination team. We have an even larger core of support volunteers. So we are excited to have, people that are willing to interpret. We have needed volunteers for Farsi and Spanish and Arabic. I mean, so many different languages. So please, if you did not indicate in your application that you can speak another foreign language and you're willing to help us interpret, please go back and do that in the Virginia Volunteer Health System, because we often query and see how many additional people that we have that can assist us with interpretation, and we will contact you directly if we have a need. So there are a lot of roles. This actually is a picture of some students that we're helping to pack up our pod boxes and make sure all of the supplies were in place so that we could roll it out to one of our pod locations. So no matter if you're a stay-at-home mom and you want to be the smiling face behind the mask and be greeting people, or you're a retiree, we really do have a place for you. Now, what is absolutely amazing is the growth, and I'm just going to go ahead and click to this screen, the growth of our program, because last year, this time, we had 10,000 volunteers. Last year, this time, we had a little over 7,000 volunteers that were deployable. That means they had gone through our onboarding process. And this is from the 28th, and today is February the 3rd, and we now have 26,000 approved volunteers. In the last 48 days, we've almost processed over 7,000 applications. This is a tremendous onboarding process, and it is taking a wonderful team of both my central office Virginia MRC team and local MRC unit coordinators really working together. So be patient. You are a part of a very large group of people that have walked up and said, we're interested in volunteering. So if we don't get back to you within, the same day of sending an email, our Virginia MRC email box has over 400 emails in it right now. So we work really hard to try to respond within 72 hours, but I think just having this situational awareness of how much we've grown in the last 11 months is just, it's mind-boggling, to be honest. I never would have thought that we would have so many volunteers. We are incredibly blessed here at VDH to have so many volunteers being able to come and work alongside of this. And you're going to see that we have many red MRC shirts. There's a few MRC units that use light blue or teal shirts, but most of our MRC units have red shirts. You've probably seen our burgundy Virginia MRC COVID-19 shirts, and that's what we're giving out to our volunteers that are supporting COVID response efforts. So importantly, you need to know who your MRC unit coordinator is. And I'm just going to roll through this really quickly. So if you're out there in the red area on this map, that's Christina Morris. If you're in yellow, that is Mary Lou Legg. And supporting Mary Lou and Christina is Pat, and he does a great job. Up in the Northwest, we have Chris Harini, and that's a really large area where we're actually finding 2 people, maybe Virginia National Guard, to help Chris in the field. In Rappahannock and Rappahannock-Rapidan, we have Jessica Connor. In Loudoun, there's Francis and Monsey. Fairfax is Paula, and Arlington, it's Christina and Christina. In Alexandria, it's Ianella and Madison. Amy is in Prince William. Alyssa is in Henrico, Chickahominy, and she co-leads with Kate, who's in Richmond City. In Western Tidewater, we have Connor. We have in Chesterfield, actually, Augustine just left. So David Woods and somebody else is covering in Chesterfield. In South Central, it's Lanita. Chesapeake, Tom. Ellen Burgess is in Virginia Beach. Samara is Portsmouth. Summer is in Norfolk. Olivia is in Peninsula, and Three Rivers is Johanna, and in the Eastern Shore is Ellen Archer. And like I just kind of mentioned, we're really looking at doubling and tripling our staff at our local MRC units because, like I said, most of those MRC units have doubled, if not tripled in size. So you might be receiving communication from somebody that's not your MRC unit coordinator because they've needed some additional support. So not always will you get an email from Chris or from Christina. It might be from somebody else that's helping to support them. Here are the core things that we expect of you and we want you to know. It's really important. Do not self-deploy. Do not go to any location unless you've been asked to do so. If you see a big tent and it says COVID-19 vaccination, if we didn't send you an alert and ask you to go, don't show up. We will assign you to where we need you to be. That is the beauty of our program and what it's set up to do. We need you to complete training. So I'm going to go over the training in just a minute. Please respond to alert notifications. If you don't respond to our alert notifications, we will resend them to you. So if you don't want to receive another call and another text message, another email, then go ahead and let us know that you're available or not available. We ask that you're dependable. If we ask you to deploy, we're expecting you to show up. So please, if for some reason you cannot, let your MRC unit coordinator or whoever is coordinating with you know so that we can reassign and find additional people to fill the role that we need filled. Maintain current contact information in the Virginia Volunteer Hall system. It's a requirement that you're committed to this mission. And if you've attended orientation and we're now 30 minutes in and you say, hey, you know what, this is not for me, that's okay. You don't have to become a volunteer. That's fine. Feel free to drop off and send us an email and let us know. But we hope that you're going to stay. And really, I hope that even beyond and after COVID-19 is over, that you stay as a part of our Virginia MRC team and continue to support VDH. I hope that you become such in love with what we do and our teamwork that you don't want to leave. That's my mission. And you're always representing the MRC, the Virginia Department of Health, and our wonderful core of volunteers. So again, do not self-deploy. What happened during the bombing in Oklahoma City many years ago is that they actually had nurses that self-deployed and tried to save people out of the building, and they were unsafe. And they hadn't been requested. And unfortunately, one of those nurses did not survive. Although we don't expect that to be the case with COVID-19, we want to ensure your safety. We want to ensure that you are provided with the liability coverage that you have as a Medical Reserve Corps volunteer. And we want you to stay a part of our team. So please don't go unless you're asked to go. All right, we'll knock that off. You are a representative of VDH, so you may be approached by the media to ask for an interview. We ask that you do not talk to the press unless you refer to the public information officer, who is typically at our mass vaccination events, or your supervisor. And if you're not on site, that you contact your MRC unit coordinator. When in doubt, ask. We have facilitated volunteers for interviews for Dateline NBC, for WRIC in Richmond. I mean, the list goes on and on. We have received so much positive press for the great work that volunteers are doing, and we would love to help facilitate that for you. So please don't talk to the media unless you've been asked to. We are having closed point of dispensing sites. So they are not made public to individuals that do not have an invite or an appointment. Please do not share any locations on your social media accounts. Share them with friends, because we don't want people showing up just begging for a vaccine that we don't have to give them. So if you're aware of a pod location, our pod appointments are booked out several weeks in advance already, just because of the limited number of vaccine. So please, if you're supporting one of those events, although some of them may be in the media, you know, our large ones like at Arthur Ashe and the Henrico Center and Virginia Beach Convention Center, yeah, a lot of people know they exist, but we have some smaller ones that are targeted for 1A or maybe 1B that are not public. So we ask that you do not share those. We will share them with the people that have signed up for those appointments, and so that they can come and get their vaccine. And that's going to change. We get a ton of vaccine, then we're going to be promoting it to everybody, but right now it's a limited amount. We're doing targeted invites. For HIPAA, you are and will have access to protected health information of the clients and individuals that come to you, our vaccination sites, and receive the COVID vaccine. The fact that they're even there is protected health information. You cannot go back to your family members and say, I saw such and such and such and such, and they got their COVID vaccine. The fact that they were there is actually protected health information. What we want for you to do is be aware that when you submitted your application in the Virginia Volunteer Health System, that you agreed to our confidentiality, our HIPAA policy, and the acknowledgement of our liability coverage. If you would like to review that document, it is located on the orientation webpage under resources, and I believe it's the very first link, so you can open up and read that PDF again. I encourage you to do so. The liability coverage that's provided specifically to Medical Reserve Corps volunteers gives us the ability to provide the same coverage that is provided to any Commonwealth of Virginia employee to our volunteers. This has been in place since 2005, and we're very blessed in Virginia to have this available to our volunteers. Many other states have not provided liability coverage in this specific designation, and it is a benefit. Although I can say right now, because we're under an emergency use authorization for COVID-19 vaccination, the governor has many executive orders that cover liability, and we have the Federal PrEP Act. There's liability upon liability upon liability coverage. I have no concerns about liability whatsoever with volunteers, and this does include malpractice. So if you want to specifically review all of the liability coverages, I have the website there listed, and you can log in. It's what all has been provided to us from our Attorney General's office, their compilation of everything that would apply to volunteers. So if that's what you want to take a look at, please feel free to go over that. So that's information about people that we serve. Let's talk about your information. You have provided us with a lot of identifiable information, personal identifiable information. We take maintaining the security of that very seriously. So our MRC unit coordinators, our public health emergency coordinators, MRC administrators, some MRC volunteers that are assisting the MRC unit coordinators have all signed agreements on the confidentiality of the information that is in the Virginia Volunteer Health System. We only share what we need to share on a need to know basis. So When you were registered, you agreed to us being allowed to share your information as necessary for your volunteer deployment. We do not give a list of all of our volunteers to other organizations. It is only managed in-house in the Virginia Department of Health for the purpose of supporting VDH events. Many of you might have indicated that you don't want to have your picture utilized in PR about Medical Reserve Corps. We're deploying so many volunteers. We ask that if you're at an event, please make sure the person that's taking pictures, the PIO, the Public Information Officer, knows that you do not want to be in any pictures or in the background of any interviews, and we'll do our, make sure that that accommodation is made for you. It's a lot of people to be able to track. So please help us, follow through with that by reminding us that that is your preference. The workhorse, the powerhouse of our ability to onboard and mobilize thousands of volunteers is the Virginia Volunteer Health System. It was created by the Virginia Department of Health, a team of myself and MRC unit coordinators and a lot of IT specialists and programmers developed VVHS. So it is just our program. It's housed and managed by a really great team out in Roanoke. And you hopefully have gone and applied for an application. What's really important for you to know is do not go and create another account. If you've already been to this webpage and you submitted an application, as soon as your application is being reviewed, either in a working or an approved process, you will be able to log back in and make edits to your profile. If it's still in a pending status, you're going to receive a notice that says that it's in pending and you cannot make edits to your profile. But you're already have an account, please don't come and hit the blue button. Come over to the section that says please sign in and enter in your username and password. It's going to bring you over to a new and improved dashboard. So if you have been in VVHS a month ago and you come now, it's going to look a little different. This has the ability for you to download your training information, download your deployments through the different menu on the left-hand side to see the alerts that you have received, see that they're listed. That's on your main page of your dashboard. So over to the right, we've created some shortcut buttons for you to utilize. One is upload certificates. So if you have training certificates, say you've completed 100 and 700 for work, or you have a specific certificate to be able to vaccinate, anything related to your training, you can click on that upload certificate button and provide that information. One of the things that I can just implore you to do is help us create a better picture of who you are by helping to enter data in the Virginia Volunteer Health System. We're more than happy to help you, but remember, we've got 400 emails in that inbox. So the more robust profile that you create, the better we're able to determine what missions are the best fit for you and how you can better serve your community. And so all the information you have is better. So help us get it in VVHS. But we want you to also make sure you update your contact information. So we have the change my contact button over there to the right, or actually you can hit the my account button too. You're going to come over and you're going to see your profile, which should look very familiar to you. It's the same format of the application when you submitted it. Over to the right-hand screen are buttons that say edit. Anytime you have the ability to make changes to the information in that section, you come and hit the edit button. When you do so, it will open up and allow you to make edits to the field. So maybe your preferred name you did not enter in the Virginia Volunteer Health System, and you would like to be called Pat instead of Patrick. So you can come in and put Pat as your preferred name, and that means when we make your identification badge, it's going to say Pat. Please include your primary email. It's important that we have email to be able to contact you because that's how we deploy volunteers. What you see, and your birth date's important because that's how we run background investigations. Now, unlike the Department of Motor Vehicles, you have the opportunity to select what picture is put on your badge. And so I thought I'd give you an example of 3 pictures and help me decide which to choose. All the way to the left is Zeus, who actually is my therapy dog, and my adorable niece. And you can't use this picture because it has a person in it other than the person that needs to be on the badge. The center picture is cute. However, it has a lot of stuff in the background, and we really need a solid background in the badge pictures. All the way to the right is a great smiling face with a solid background, and that would be perfect for your identification badge. You can hit the select image button, and when you click on that, it'll allow you to upload whatever picture you want to be on your identification badge. Now, if you have any issues with that, please feel free to email our Virginia MRC email inbox, and Laura can put the address up in the chat at any time, and you had problems uploading your headshot, we can help, and we can do that for you. The next section in contact information that is most important is this phone and text alerts. This is how we communicate with you when we need to alert volunteers. So if you have the ability to receive text and phone, please enter and indicate that phone number that you are willing to receive text messages to. Sometimes emails do not always go through, and we may choose to send an email and text message. And so it's kind of our backup plan, and it's very helpful. So our text messages go through really quickly. Sometimes our emails are a little delayed. So it's our communication backup. So please make sure you click on the both if you'll do phone and text message. Please don't put your work address that has, an extension to your phone or something that's going to get to a general inbox for your alerts and VBHS. Make sure they are phone numbers that are unique to you. We also need to have credentials in our system so that we can verify who you are, what you're licensed to do, and whether or not you have any CPR certifications. In each of the sections in your application in VBHS, just like where I talked about for putting your profile picture in, you can upload your picture. So we need your driver's license picture and your headshot in order to automatically process your background investigation in the background. That's all you need to do. We will make it all happen, but those 2 documents have to be there. In addition to those documents, updating your license information from the Virginia Department of Health Professionals, DHP, helps us to verify your license. And so you do not have to upload a picture of your DHP license, although it's very helpful to us if you do. If you properly put in your license number and choose Virginia Department of Health Professions, every night we validate licenses in Virginia, so it would be there. If you have an out-of-state license, please also enter that information because we are going to start validating out-of-state licenses as well. Any information, even if it is an expired license, please put it in license and certification. And that will help us determine whether or not you can be a vaccinator or not. At the bottom, there is an area for current CPR life support certifications. So if you have a CPR certification, please also add it into that section and you can upload a picture of that document. That's a lot of information for you to put in, but it's really important for us as we decide who do we deploy and how we assign you to different roles. And preparing to respond is making sure we have that information. And we have a structure, a process to manage these very large vaccination events. And here are some Fairfax MRC volunteers showing the incident command chart and the reporting of every section and unit within our structure for our point of dispensing sites. And so this orientation is a requirement for Medical Reserve Corps volunteers. If you're going to be supporting a point of dispensing event, so a community vaccination event, we really recommend that you take our COVID-19 mass vaccination overview. It's not required, but it's really recommended because we help you understand what this looks like. Our mass vaccination is not like going to your doctor's office. This here, I think that's the Henrico Center where they had the large event in Henrico. They vaccinated, I think, close to 5,000 community members in 1B that were 65 and older. So if you would be interested in attending that training, we have a training calendar. You can go to that page and it has all of our live trainings that we offered and as well as recordings. We offer orientation and the mass vaccination overview multiple times because the content changes. There's one thing that is absolutely certain about COVID is COVID changes, and it could change as quickly as one email. And so we want to make sure that information is current. So if you've taken it before, you don't need to take it again. We just ask that, take it once and you're good to go. The main content will be the same. The introduction from our vaccination team or where we are in the phases might be a little different, but really it will help you be COVID vaccination smart and plug into our operations really seamlessly. If you want to become a vaccinator, we have online training that is required to be a vaccinator. And actually, it's required of any vaccinators, not only MRC, but public health vaccinators, anybody that comes in and helps us administer the COVID-19 vaccine under this EUA. Currently, there's a requirement for CPR within the last 2 years. However, I think that requirement might be waived. We do have some scholarships that are available if your CPR is totally expired. But I think there's a pretty limited, even right now, we've dipped into our entire pot of CPR scholarships. So it's not as much of a pressing issue that it has been in the past. All of the requirements for training are at that website at the top, MRC/COVID-19 vaccinator. It has links to every single one of these trainings that are listed. So there's a Moderna, there is Pfizer, there's EpiPen, and some of these courses are literally 5 to 10 minutes. So if you are currently administering vaccinations in your work, and being a provider, working in a physician's office and such, your training requirements are much less than those that have been, maybe retired and not working in the healthcare field. Of all vaccinators, we do require a skills assessment that is done in person. Sometimes it can be done just before a vaccination event, or sometimes we try to schedule those in advance of a clinic. So it might vary how that is offered to you. So visit that site. Now, that training is on Train. The online training is on Train. So until your account in the Virginia Volunteer Health System is approved, you cannot go in and take that training. Train and VVHS talk, and as soon as your account is approved, we create an account for you overnight. And we provide instructions in your approval email on how to log into Train. Train is a library of tons of public health information. You're welcome to take anything that you see in Train. We do have those required courses, but if you're a student or you're looking to, really pursue a career in the public health field, feel free to dig in to train and take any courses that you would like. Some of them do have CEUs. Make sure you look in the course description to see if they have CEUs and follow the instructions there to be able to apply for CEUs. So do not create a Train account. Now we have a wonderful Train administrator named Brad. And if you get stuck and somehow you can't access your account and you're having a problem, please feel free to email Brad at va_admin@training.org, and he can help you with that. If you already have a Train account, say from where you work, as long as your email address is the same in VVHS as it is in Train, all of your training that is in Train right now will come over and be viewable in VVHS. Super awesome. So we don't have to go into Train to see what training you have. It's all dumped into the Virginia Volunteer Health System. Want you to see just kind of what the landing page for Train looks like. If you're given course numbers, you can come into, and the very easy way to find courses is if you go to the very small little investigation button, click it, it'll open up, enter in the course number and search, and it'll bring you up the course, and you can click on the course then and launch the course and watch the training. It'll automatically be documented in Train, and it'll automatically be documented in the Virginia Volunteer Health System. You have the right to download all your information, things that you've done and training for your service as an MRC volunteer. You can just go to Training Reports over to the left, and it is you can export a PDF, and it'll list all the trainings that you've taken. And you can provide that to your school or your employer for documenting any additional education that you've needed. So you have access to that information. We hope that that will be beneficial to you. All right, so how do you get from having all your information, completing training, to out in the field? We only deploy volunteers when they are requested. So we receive a request. Actually was talking yesterday in the Crater Health District. They have 2 vaccination events and they need vaccinators. So we got the request and we sent an alert out in the Virginia Volunteer Health System to the people that were licensed to vaccinate. We're screening that list, and then we'll provide another communication to them to let them know that they've been selected for that deployment. Our communication, our alerts that come out in VVHS have some categories. They're kind of shortcuts for you to understand how important the alert is. So our communication is a newsletter, or we're having a session, please come and visit with us. I know we have some MRC unit coordinators are having Zoom meet and greets. So that might come out as a communication. And awareness is we're planning for something. If you're interested, please, just a heads up. Readiness is we're creating this team. We need you to sign up to be a member of the team. Activation is you're a member of the team and we need you to show up next Saturday. So please confirm that you're going to show up. We use emergency if really we need a response within 24 hours or need people to show up within 24 hours. And our deactivation alert is we've had it, had some coordinators have to send it because vaccine was not available and delivered. And so we had rostered people and had already told them to deploy, and we had to send a deactivation alert to tell them that they were no longer needed. In those alerts, you're going to receive an email, and the way that you indicate availability is going to be via the email. It'll have a short call to action summary about what the alert is about, and you have a unique link just to you in that email message that you open up, and that's how you confirm. You click on that link and then you're going to get a message, and typically we use the format of who, what, when, where, how to respond, and additional information. Please read through it completely. Make sure that you're available, that it's appropriate to you for you to respond, And then you're going to choose, I'm either available for the event or I'm not available for the event. Those are based on the 2 buttons that are below. Now, we are scheduling lots of events for an entire week at a time. Some of our units, if there is an ongoing event for months, say the call center, they may be using Sign Up Genius. However, many of the coordinators use VVHS to schedule for clinics. And that's going to look a little different. It's going to have multiple shifts and options, different days and times, and different types of volunteers that are needed. So you'll see, I need COVID vaccinators, I need pod workers, whatever is needed, it will be over there in the roles section. So if you were available for both of these, you would click available on both of the boxes and you would go down and choose the blue button. If you are only available for one, you click one. If you're not available for any, you don't click any of the available and you just go ahead and click the red. So please make sure you look through that very closely so that we aren't having to reschedule and move you to different shifts on the same day. We might have, actually, I know on Saturday, for example, we have 5 different locations with the same shift for vaccinators. So you would have to be able to choose which locations that you would want to support. Email is super important. And as you can imagine, when I send a statewide alert, it's a little scary because I hit the send button and it goes to 26,000 people. Sometimes email providers look at that and they think it's spam. So please make sure that if you say you get a text message and you haven't received the alert that went along with the text message, dig into your spam and junk folder because more likely it's going to be there. So save the no reply at VA MRC as a safe contact, and that'll let your email provider know, please don't put this in the junk. And you can do the same. Some providers, when you see it in the junk bucket, you can say this is safe and it'll put it in your inbox. We are constantly working with all of our systems for email communication to make sure that we're not being blacklisted and so that the email communications go to you. In addition to email, we have phone and text messaging. All right, get your phone out. I said you have an activity. Get your phone out. You will receive alerts from always the same phone number, and don't want you to think that it's somebody trying to get you to buy a timeshare or donate money to any organization. So in your phone, I want you to enter our phone number of 804-864-7200. That's where the phone calls are going to come from. You cannot call back that number. It's just a one-way number. So no phone calls back to that number, but when we send you an alert, that's going to be what comes across your phone. So you want to save it. Maybe it says, Virginia MRC or MRC alert, however you want to put it in there, just so that you look down, you go, oh my gosh, I got an alert for MRC. They probably need vaccinators. Let me look and see what that's about. If we're only asking for available or not available, we might give you the option to choose either 1 for available or 2 for unavailable. Now, you cannot respond via text message. So you can't go yes or no via text message. We don't have that functionality in VVHS at the moment. But you can, if we provide you with a phone number to call or to text back on, you might have the link to be able to do that, but you can't reply back via text message. Your alerts are in the Virginia Volunteer Health System. So if you think something's going on and you didn't get the email or the text message, you can always log into VVHS and you can see the alerts that were last sent to you. If all else fails, you can also call your MRC unit coordinator or whoever the point of contact is for your MRC unit. What we want you to be able to do is when you are available that you are able to say, I am available. Pick me, I'm ready to go. I'm so excited to go. I'm really excited to be an MRC volunteer. Make sure you read your alert and you say, okay, I'm definitely qualified for this. You know, I don't have any stress going on in my life. I'm, you know, got a positive attitude. I can go and give it my all. And you can make the commitment for the time that's available. Because we have so much going on, it's very difficult for us to make accommodations. Oh, I can only get there until 9:30. I know you start at 9. It's really hard for us to make accommodations when you can't serve in the entire shift. So if you can't serve the entire shift, just say you're unavailable. Some of our unit coordinators are providing people an opportunity to be on standby. So if you're on standby, that means if the other shifts are already filled and you still could support, you could choose standby. And then we'll contact you if we need additional people. So understand the nature of the request. You know, you recently hurt your foot and you don't feel comfortable standing for long periods of time, please don't sign up to be a greeter because that's what we'll be asking you to do. Maybe doing data entry would be a better fit. So make sure you understand that nature of the request and make sure you feel comfortable. You know, if we're asking for vaccinators, you're going to have to gone through that checkoff process to be vaccinators or completed that online training. So help us, don't sign up for things that you don't feel comfortable doing or you haven't been trained to do. It always comes up as, you know, especially early on when we didn't know as much about COVID-19 as we do now. You know, when is the right time for me to serve? I'm older, I'm concerned, I have a health issue. I have a family member that has a health issue. You know, what we say is you are the one to decide when it's the right time for you to volunteer. If you feel more comfortable waiting until you get your second dose of vaccine, please wait. I mean, right now we have enough volunteers. When we get in phase 3, late phase 2, we're going to need anybody and everybody. But right now we have like the A team, the 1A, 1B team out in the field, and we're good. But we're going to need that phase 2 and phase 3 team. So feel free to just kind of be on standby. We will assign you with PPE if that's appropriate. So please wear it as instructed. And if you want to serve in lower risk positions, you know, maybe being at a vaccination event is not something that you want to do, but maybe packing care kits is something that you're comfortable doing, and, you know, make that choice. So you should understand your risk. And if you have any safety concerns, please let your MRC unit coordinator know. We will document it in your profile in the Virginia Volunteer Health System. And then the next time we go to deploy you, we will say that you're not comfortable serving in this type of position. So we're happy to, you know, make those accommodations for you. It is okay to say no. We have enough vaccinators at the moment. We are bringing more people on board. There isn't like this huge urgent rush, but whenever you're sent an alert in VDHS, it's okay to say no. What our hope is that we have this huge pool of volunteers that are ready to respond. And when we need somebody, there's going to be enough people to show up and make it happen. So don't feel guilty. It is okay to say no. When you go, know that this is voluntary. So, you know, you're not being paid. Obviously, there's great value in being a volunteer. You're representing the MRC, the Virginia Department of Health. We ask that you wear your appropriate badge or shirt if it's provided to you, or you'll be getting it when you show up to volunteer. Follow the instructions that we provide to you. Make sure that you document that you were there so that we can give credit to you and the Virginia Volunteer Health System, but also so that we have a safety understanding that all the people that we're accounting for are on site if something were to happen, that we can make sure that you're okay. You'll be provided with job action sheets, maybe some just-in-time training to review information that, you know, has changed. We take Moderna vaccine now, and we're going to have a new vaccine that's going to come out, Johnson & Johnson, we hope soon. So, you know, training might be just in time, and wear the appropriate and fit tested PPE. Here's what we know. Things change constantly, semper gumbi. It is a hurry up and wait situation. We are bringing on tons of people, we're waiting for the vaccine, and then we're going to deploy tons of people. So be ready to be flexible. I've had a few volunteers on Facebook recently say, I'm so excited to go, but I'm not going to self-deploy. I'm like, yes, the orientation works. So be flexible and just stand by, because it is going to be your term eventually. We have thousands of people in line to be vaccinators. So you may not be vaccinating in 1A, it might be in 3, a little later on down the road. This is incredibly rewarding work, but it is stressful. The pressure is pretty high on our team here at VDH. And, you know, we just ask that you don't feel obligated to, you know, support every single vaccination clinic. Please take care of you personally, your mental, physical health, so that you, for the long haul, you can help us. And I think, you know, the biggest benefit of volunteering is that you get to give back to your community. You create relationships with people that you didn't know. I think it's wonderful. We actually have a lot of husband and wife teams. We have, you know, parents that bring their child along, their older child. So we have volunteers that are 18 and older. And, you know, it's coworkers, whoever it is, we work together as a team, and hopefully you will find that very rewarding to be, you know, working with other people that have a similar mission and passion alongside of you. Here in summary, I want you to know, you represent VDH and the Medical Reserve Corps. You will be activated when you are needed. So don't go unless we ask you to. Make sure you respond to the alerts. Don't talk to the media unless we say A-OK. You will get your train account created for you. So don't go in and create a train account, and just be on standby for deployment. Take any additional training. You know, we've said what the required is. You can take 100 FEMA 100 training, 700, 200. The more training you take, the more qualified you'll be for more leadership positions. But there is some bare minimum training. So feel free to be an overachiever. What is next is we will make sure your application is approved if it is not already approved. We will make sure we have the photos and background investigations that we need, photos needed for background investigations and your identification badge. Complete the online training if it's appropriate for you, our online, recorded, in person, you know, those that have been posted in train. Be ready to be mobilized and go out and serve your community, and also be demobilized, so that once we get done with COVID, I don't know, it seems like it's endless, but once we get done, we'll all demobilize and have a big celebration party, that's for sure. Now, we've ended the orientation, but don't go yet. In order to take roll call, you're going to go to this website. This is the website that we use to track any training, that live Zoom training that you participate in. So it's our website, vdh.virginia.gov/MRC/roll call. Any Zoom training you take, you're going to go there. It's going to ask for a secret phrase for this orientation. The secret phrase for this orientation is for VA MRC rocks. VA MRC rocks. Doesn't have to be capitalized, all that, just VA MRC rocks. And that will document that you attended today. And we'll get that uploaded into your profile. It's usually taking about 72 hours for that to be documented in your profile in VDHS. Once you have your orientation documented and your background investigation is complete, you will start receiving alerts in VBHS. That will not be immediately. We are processing right now over 700 background investigations. So it might be next week, but just be ready. You're going to get there in line eventually. Once we get those two things done, you'll start receiving alerts. To conclude today, can say thank you. Thank you for stepping forward to serve your community and to come alongside us in public health in this unprecedented global pandemic to make Virginia healthier. And we look forward to serving alongside of you to really being a part of our public health team. And, on behalf of our state health commissioner, Dr. Oliver, our deputy commissioner, everybody on our VDH team, we can't say thank you enough. And I have now ended the orientation, but I'll open it up. Laura, do we have any questions that I can answer that perhaps I didn't cover in the orientation?
We do have quite a fefew questions about the out-of-state licenses. So the EO 57, the House Bill of the 2333. So a lot of people asking about those by name. I don't know if you can clarify what we do know at this point.
They are on or will be, if they're not already, on the governor's desk for signature. So what EO 57 extension will allow us to do is to accept out-of-state licenses. So that will open up the gate to those of you that have out-of-state licenses. House Bill 2333 in House Bill, the EO 57 allows dentists and dental hygienists and veterinarians to vaccinate. Yeah. And then House Bill 2333 will allow retirees with their licenses that were in good standing within the last 20 years to be able to vaccinate as long as they receive updated training and their skills check is done. So we're literally waiting for the pen on the paper to sign off on that. There's a lot of logistics that are required to do that extra credentialing. So just know that if you fall into those categories, we're working on credentialed to licensed healthcare providers first, and then we're going to get to our what I call COVID special licensed healthcare providers second.
Great. The other general question was about train, but just reiterating that once your application has been approved, you will then receive access. There are a lot of people asking if they've already had IS 100 or any other certificates. What is the best way for them to get those logged into their account as well?
Yeah, so if you have those certificates, remember when I showed you in VDHS your dashboard, over the right-hand side, it says training certificates. You can click on that and just upload your certificates for 100 and 700 there. And you'll get, as soon as your application is approved, you get an email that says, thank you for volunteering. It says upload your pictures, and here is how you can log into Train. It does take 24 hours for your Train account to be created. The Train account username will start with VVHS, and then it'll be, a number. I think it's either 4 or 5 numbers after that.
It looks like a few people are saying that they're trying to click the button for uploading their certificates and there may be a glitch. Okay. So we will work with our IT team, and that should be fixed later today. That shouldn't be a problem.
And I say VVHS works best in Chrome rather than, don't use it in Internet Explorer because you probably will get glitches. Chrome, Safari, Firefox, IE is kind of archaic at this point, and VVHS isn't compatible with it.
I think that's mostly everything that we've gotten.
Great. Well, thank you again for joining us. And if you need some tech support in VVHS, you can send the email to vamrc@vdh.virginia.gov. And our team of Laura and others will do their best to get back to you as soon as possible. So thank you again for joining us, and have a great day.